Good morning. I'm so excited to be here and talk about transforming and evolving to meet the community needs. This announcement has been 40 years in the making as ECU and Vidant Health come together to build ECU Health. And I'm just so excited to be able to give this update. There's really been no time in history that this is more important. With all of the effects of the pandemic and what's going on internationally, nationally, and locally, coming together and building on the strengths that are Vidant Health and ECU and Brody School of Medicine and bringing those together to do regional transformation, there's no more important time than right now to do that work. And as we look into the future together, we're really building on the strengths that those parties bring. So ECU is an incredibly strong university that produces more healthcare professionals than any of the systems in the UNC, any of the institutions in the UNC system. And so a huge amount of capability and expertise at ECU. And then in Brody School of Medicine, an incredible legacy of serving this region and producing physicians that serve North Carolina uniquely. And then Vidant Health, a very strong regional rural integrated delivery system that serves 29 counties of eastern North Carolina and is intimately involved in those communities. So together, as ECU Health, we will continue to build on those foundations and meet the rapidly changing healthcare landscape. And we are positioned well for that future to create success for our communities, for our institutions, and for our team members. And so we're so excited about that. The ECU logo, ECU Health logo, is a symbol of our shared commitment to do that work as we serve Eastern North Carolina. And we concentrate on regional transformation, driving value in healthcare services, and educating the future healthcare professionals to serve North Carolina from Murphy to Manteo. Building on the strengths of both organizations and working together, ECU Health is positioned to build that bright future. I just want to thank you all for being here and to ask questions and to celebrate with us the announcement of ECU Health. With that, I'll hand it over to the Chancellor.
All right, well, very good. Thank you very much, Dr. Waldron, and good morning to all of you. Once again, thank you for being with us for this moment of celebration, and what a special day it is indeed. A special day for East Carolina University, a special day for our community, a special day for our health system and our many partners, and perhaps most importantly, a special day for the people of Eastern North Carolina, those individuals that we will serve in a meaningful way through the work of ECU Health. This is a breakthrough moment. This is a breakthrough moment for the future of rural health care in our state. And I'm so proud, I'm so excited to be standing before you today as we're unveiling the ECU Health logo for many reasons, but perhaps most importantly because it is in every way a visual symbol of the reasons and of the shared commitment that we bring to this region and to the people that we serve each and every day on behalf of ECU Health. You all know this well. I've been proud to call Greenville, North Carolina home for many years, and I hope that is the case for a very, very long time. But now it's going to be very extra special to enter our community from the west and know that this ECU Health logo will be one of the first things that people see when we're inviting them in right here to Greenville, North Carolina. And it's my hope that it will be clear to everyone all throughout Eastern North Carolina that we are invested in our region and that ECU continues to be an important player in educating healthcare professionals for the future of our state and for providing clinical care to the health and rural health needs of North Carolina. I think what I love most about today is that it demonstrates the unity and the engagement and the impact of our shared partnership that we have together. It embraces our shared vision for ECU Health, and it embraces, as Dr. Waldron said, the very best characteristics of both of our organizations, East Carolina University and our health system, working together for good to create a national model, a national academic model for rural healthcare delivery in our state. When you see this logo moving forward, I hope, like me, it represents for you the blending of resources in education, in research, in clinical care across our region. And I hope it represents our efforts to maximize those resources for people all across Eastern North Carolina. Our hope, our intent, our desire, our expectation is that all stakeholders that we serve will benefit from this engagement. We hope that our students will be able to move forward with even more opportunities to learn and to develop their clinical skills throughout the many hospitals and service centers throughout our region. Our hope is that our faculty will have the opportunity to come together in meaningful ways with providers to bring expertise and experience for interprofessional collaboration and research. And of course, most importantly, we hope that our patients will be able to move forward with receiving that high quality care that they need, that they want, and that they deserve through ECU Health. Now, as Dr. Waldron said, there are so many people to thank that have been a part of bringing this effort together, and I want to take a moment to thank all of the members within our community. I want to thank the ECU Board of Trustees, the UNC system, the University of North Carolina Board of Governors, of course, both of the boards that represent the health system and the medical center, and of course our representatives in the North Carolina General Assembly. All of those folks were vital for making this partnership come together, for making this clinical integration possible, and our legislators in particular played an important role in investing in this work by bringing $215 million into the Brody School of Medicine to create a new medical education building that will allow us to advance these initiatives that will allow us to move forward the shared vision of ECU Health together. And so for that and so much more, we are immensely grateful. I can't stand before you today without thanking the great people standing to my left and to my right, Dr. Mike Waldron and Dr. Jason Higginson, who were integral in this moment, along with their respective teams at the health system and at the Brody School of Medicine, and the many faculty and staff who have worked tirelessly for those of individuals that we're serving in our region and the people that we are hoping to provide care to. As a university, we treasure these opportunities to bring out the best in who we are and what we do. And we've been delivering on our mission at East Carolina University of public service and regional transformation and student success for more than 115 years now. And this is just the next great chapter in that process. This is the next waypoint that will allow us to meet the rural healthcare needs of the people of Eastern North Carolina, that will allow us to bring hope and health to the East. And I'm honored to have a seat along the ride on this journey. So thank you all very much for being here today. I'm pleased to introduce Dr. Jason Higginson, who will share a few remarks, and then we'll take some questions.
Thank you. Well, I appreciate the opportunity to be here today, and to you, Chancellor, and to Dr. Waldron for the confidence placed in me and what this represents. So I'm pretty simple, and I can be pretty brief. When I think about things, I think, what is the mission? So if you think about the mission of ECU, it's regional transformation and student success. You think about the mission of the School of Medicine, it's to build a diverse healthcare workforce, improve the health of people of Eastern North Carolina, and provide primary care physicians for North Carolina. And then if you think about the mission of Vidant, it's to improve the health and well-being of Eastern North Carolina. So to me, what ECU Health symbolizes and this logo symbolizes is that all of those threads are tied together, and they always have been, and none of those missions are changing. And the Brody School of Medicine has met its mission. It is one of the top producers of primary care physicians for North Carolina. If you look at any of the schools in North Carolina, we produce the most students who stay and serve the people of North Carolina. And we've engaged in Eastern North Carolina to improve health and well-being. And we could only achieve those outcomes if we have a partner like Vidant, now ECU Health, to provide opportunities for our students to learn and develop as clinicians. And so what this symbolizes to me is that this represents a continuation of the long success that all these institutions have together, and now we forward face as one. And I'll leave it at that. Thank you.